Bipolar disorder, formerly known as manic depression or manic depressive illness, is a mental disorder characterized by recurring highs or lows. There are several types of bipolar disorder, ranging from bipolar type 1, bipolar type 2, and cyclothymia. Watch on to find out more. Hello, my name is Karen and welcome to another Project OMOW video. Today we'll be exploring bipolar disorder. As mentioned earlier, bipolar disorder was formerly known as manic depression or manic depressive illness. It was first identified in the 1st century in Greece by Aretius of Cappadocia. He documented patients who would laugh, play, and dance and then become torpid, down, and sorrowful. It was common for the people who suffered from bipolar disorder or other mental illnesses to be executed, as some religious people believed that mentally ill people were possessed by demons or should be put to death. The term bipolar literally means two poles, indicative of how people with bipolar disorder swing from extreme highs to extreme lows. Depressive and manic episodes can last for several days to a few months. Some people experience these mood swings frequently, at least once in a few weeks, or rarely at all. During highs, people with bipolar disorder will feel at the top of the world. They may be enthusiastic, impulsive, and full of energy. This can make them prone to unwise decisions, such as gambling or spending sprees. Depressive episodes will make people who suffer from bipolar disorder experience things covered in our first depressive video, What is Depression? Together, they alternate between these highs and lows and are diagnosed with bipolar disorder. So, what's the difference between bipolar disorder in general and the bipolar subsets? There are three main types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymia. The main difference between bipolar 1 and bipolar 2 would be the specific of manic episodes. People with type 1 bipolar disorder tend to have milder highs, while people with type 2 bipolar disorder tend to have less intense highs, called hypomania or hypomanic episodes. To be diagnosed with a manic episode, the person must experience symptoms that last for at least a week, all day, every day, or have symptoms serious enough that they are hospitalized. Major depressive episodes generally last for at least 2 weeks. Bipolar type 1 is diagnosed when there is at least one manic episode. They may or may not experience a major depressive episode. Whereas bipolar type 2 is diagnosed when there is at least one major depressive episode that lasts for at least 2 weeks. They also have at least one high episode that lasts for about 4 days. People with cyclothymia experience both episodes of hypomania and depression. The symptoms are less intense and shorter than people with type 1 or type 2 bipolar disorder. While it's still not clear what causes bipolar disorder, some causes include genetics, personal brain structure, and environmental factors such as extreme stress or traumatic experiences. If you suspect that you or someone that you might know may have bipolar disorder, here are some guidelines you can use to figure out if your intuition is right. Do know that these assessments are only guidelines and not a recommendation or diagnosis. These are simply options which medical health professionals may use to determine if you or someone else has bipolar disorder. Firstly, your physician may order a physical examination to rule out other potential illnesses. They may also have you go through a mental health evaluation carried out by a psychologist or psychiatrist. Secondly, doctors may refer to the DSM-5, otherwise known as the Diagnostic and Statistical Manual of Mental Disorders. The DSM-5 is a helpful outline for doctors to confirm if a patient has a bipolar disorder or not. Lastly, they may ask you to keep a mood journal to chart your feelings, whether there is any highs or lows. This can help them assess if these factors are due to lifestyle habits or due to bipolar disorder. Although this list is not comprehensive, the following are signs of potential manic or depressive episodes. Some symptoms for manic episodes include feeling overly happy or high for a long period of time, a decreased need for sleep, feeling restless or impulsive, having overconfidence in your abilities, or engaging in risky behavior, such as having impulsive and unprotected sex, gambling with your life savings, or big spending sprees. Signs of a depressive episode are mentioned in our previous video on what is depression, but here are some poignant signs of a depressive episode. Some signs include withdrawing or isolating from others, feeling severe fatigue or a lack of energy, having problems with memory and concentration, and thinking or attempting suicide. If you or someone you may know is showing these signs, some things which may help you cope or help them cope include the following. Educating yourself is a helpful place to start. By learning more about hypomania or figuring out your own individual triggers or symptoms, it will be easier to help yourself or others cope. Keeping a mood diary can also help. Charting your moods can help you and a medical professional work together to keep your mood under control. If you don't have access to a medical professional, this could still help. Tying in with the point about educating yourself, a mood diary could help you figure out your triggers or symptoms. Lastly, asking for support can help. Although it is heavily emphasized, most people with mental illnesses do not reach out to their loved ones out of fear from being judged or being afraid to burden them. This is not true. There is always someone who is here for you, be it trusted friends, family, or even a support group. Bipolar disorder can be detrimental to yourself and others if not managed properly or aggravated. If you're suffering from bipolar disorder, do your best to stay in your treatment course. I'm sure it will be worth it in the end. Thank you and see you in the next video.